That report. And I talked with a St. Louis doctor who is on a mission to help decrease the spread of COVID-19 by using creativity. The global demand for personal protective equipment has created a severe shortage around the world, and New York is one of the hot spots. Some St. Louis doctors have been reaching out to provide support.
New York needs a ton of help. They're actually bringing doctors out of retirement. They're asking people to volunteer. They're asking nurses, nurse practitioners. The death toll is continuing to climb.
With face masks being in short supply during the coronavirus outbreak, people were coming up with creative alternatives.
It's definitely a crisis. We're in a shortage. So, like I said, numbers are going up, supplies are going down.
Dr. Ebony January is urging people to use innovative face masks by making their own. It's called the Bra Mask Challenge, and it's sweeping the nation.
Mine actually has a button, and obviously you can wash this as opposed to a disposable mask that we get in the hospital. So it offers some level of protection. So great idea, and kudos to the physician who actually developed this.
And I tweaked my own. I made a button, and I made it adjustable.
Dr. January says, of course, you cannot make N95 masks, but now that the CDC recommends that you wear non-medical cloth masks to help prevent the spread of the coronavirus, there are alternative and affordable ways that you can help protect you and your family. Dr. January says masks can be made at home and can be used when entering public spaces such as grocery stores and public transit stations.
The Bra Mask Challenge is essentially getting people involved in taking control of their own outcomes. A lot of the protective equipment has been limited, especially as it pertains to me as a healthcare worker, but I know there are people who still have to go out. So if you must go out, even though we're saying to stay home, but if you have to go out for the essentials, the necessary, if you're sick and have to go to appointments, no access to masks, then I challenge people to make their own bra, their own mask, be a bra.
A 90-year-old woman from the Life Center in Washington contracted COVID-19 and was almost near death, but she bounced back and returned to good health. CNN's Sarah Sinder shares her remarkable story of recovery.